Mini gastric bypass, MGB, and Roux-en-Y gastric bypass, RYGB, are two types of bariatric surgeries designed to aid in weight loss and treat obesity-related conditions. While both procedures are effective, they differ in technique, risks, and outcomes. Here's a comparison. Surgical technique. Mini gastric bypass, MGB, a single anastomosis connection, is created between a long, narrow stomach pouch and a loop of the small intestine, simpler and quicker to perform than RYGB. Roux-en-Y gastric bypass, RYGB, involves creating a small stomach pouch and connecting it to the small intestine in a Y configuration. Requires two anastomoses, stomach intestine and intestine-intestine, making it more complex and time-consuming. Surgical duration, MGB shorter, approximately 45 minutes to 1 hour. Longer, approximately 1.5 to 3 hours. Weight loss. Both procedures result in significant weight loss, though MGB may have slightly faster initial results due to more malabsorption. Nutritional deficiencies. MGB, higher risk of deficiencies, iron, calcium, vitamin B12, due to longer bypassed intestinal segment. RYGB, lower risk, but still requires lifelong supplementation. Reflux and dumping syndrome. MGB, higher risk of bile reflux since there's no mechanism to prevent bile from flowing into the stomach. Lower risk of bile reflux, but higher potential for dumping syndrome, rapid gastric emptying. Complication rates. MGB, lower complication rate due to a simpler surgical technique. However, long-term bile reflux can lead to gastritis or esophagitis. Higher complication rate, e.g. internal hernias, strictures, but less bile reflux. Reversibility, easier to reverse or revise. More difficult to reverse due to the complex anatomy created. Long-term outcomes. Both surgeries are effective for long-term weight loss and improving comorbidities like diabetes, hypertension, and sleep apnea. Might have slightly better weight loss outcomes due to greater malabsorption. Suitability. Suitable for patients seeking a quicker surgery and who can tolerate a higher risk of reflux. RYGB, better for patients with severe acid reflux or a need for reduced risk of bile reflux. Summary table. Feature, mini gastric bypass, Roux-en-Y gastric bypass, RYGB. Technique, single anastomosis, two anastomoses. Surgical time, shorter, 45 to 60 mins. Longer, 90 to 180 mins. Weight loss, significant nutritional deficiency, higher risk, moderate risk. Reflux risk, higher, bile reflux, lower. Dumping syndrome, less common, more common. Reversibility, easier, harder. Long-term success, high. Your choice between MGB and RYGB depends on your medical history, lifestyle, and surgeon's recommendation.